Joining us today is Tommy Pearce. Tommy is the Executive Director of Neighborhood Nexus. Before we jump into that, just a few thank yous to our anchors, WorkSource Georgia, State of Georgia, Chamber of Commerce, Goodwill, Atlanta Career Rise, Georgia Economic Development, First Step, and the University System of Georgia. So thanks to all of those groups where you're able to bring you all these opportunities through MAX. So again, Tommy's going to be leading us in a PowerPoint about Neighborhood Nexus and some of the tools and trends we can see in our communities as we're all kind of navigating the world of COVID and all that we're seeing with relief efforts and recovery efforts, evictions, jobs, that sort of thing, so which I think will be applicable to many of us on this call. Just a few reminders, you should all be muted right now as you're watching, but you can unmute yourself if needed. If you do have questions, we're going to ask that you put those in the chat box and we'll kind of monitor those as Tommy's going through his presentation. If something needs to be addressed immediately, we may pause and I'll bring those up, but if not, we're going to try and hold most of the questions till the end of the presentation so we can get through those. And then we'll have just a couple other updates for you all. So Tommy, if you want to take it away, let you dive into your presentation.
Great. Give me half a second to figure out how to navigate
share screen technology these days.
All right. You're all seeing something that says Neighborhood Nexus on it?
Yep, I've got that.
Perfect. And all right. I don't see the chat box.
I'll watch the chat box,
okay,
Tommy.
cool.
So I'll keep an eye on that for us.
I only have 2 monitors. So.
I'll keep an eye on chat. You focus on presentation.
All right, great. Well, good morning, everyone. Happy to be here. I'm Tommy Pearce with Neighborhood Nexus. I'm going to spend a few minutes talking about Neighborhood Nexus in case you aren't familiar. If you haven't seen us, you've probably seen some of our work. And then I'll do a quick walk through some of the tools that we've been working on to make data a little more accessible, especially in these times. And then I will also walk through some of the trends that we're seeing across some of the subsectors in our social sector and in the community. So, I told Amelia just a second ago, I think just this morning I added like 5 slides and deleted 8. It's a complicated story to tell, and so just trying to keep it relatively high level for this one. And then also, like she mentioned, we made this a Zoom meeting instead of a webinar so that we can have a little more discussion if anyone is interested. I probably have more slides than I'll get through, so I don't feel any pressure to get through it. I think Joy will send out all the slides later so you can see everything later and follow up. I put links to everything I share. So, all right, let's do it. So Neighborhood Nexus, we really focus on helping organizations, mostly nonprofits, local governments, and community groups to align their services, whether that's kind of policies, investments, or programs, to community needs, and we help understand what those community needs are by working with community data. Right? We are a data shop that likes to sort of stress don't use too much data. Right? So data can get you in the right direction. You should still always go talk to people, find local partners, and so. We know data is not everything, but we're really trying to help make better decisions, tell better stories, and I'll talk a little bit more about that in a second. We are a collaborative of 4 main regional partners. The Atlanta Regional Commission is where we're actually physically housed and partially staffed. The Community Foundation for Greater Atlanta is another co-founding core partner of ours, and they're our fiscal agent. We're also core partnered with the Metro Atlanta Chamber and United Way, and that really puts us at the intersection in Georgia of regional planning and government, philanthropy and human services, and the business community. So we feel like we truly are a nexus. Nationally, we're the local affiliate of the National Neighborhood Indicators Partnership, which is based out of the Urban Institute. So through the pandemic and really long before that, we have pretty regular check-ins with community data folks around the country, figuring out, how have you been supporting your city or your state? And so a lot of what we do is informed by what organizations are doing across the country and thinking about data. The reason that community data is so important is what we really risk by not using it. We risk unfilled service gaps, wasting critical community resources if we aren't kind of aligning our investments with where the need is, or aren't providing the right services to the right community. And that also limits our impact and effectiveness, right? So everything that we're really doing, we like to say data driven. I really think we're data informed. We're impact driven or equity driven. That's what drives our work. And so the way we approach this is to support organizations to ask the right questions, use the best data, tell compelling stories, and ultimately make informed decisions. A lot of folks start with use the best data, but that's hard to do without asking the right questions. And our three main programs look like this. So most of what most people know about Neighborhood Nexus is all the tools that we have online. We've just released a brand new mapping platform where you can kind of pull a lot of census data, public health data, education data, whatever you're looking for. You can find it all in one place instead of just Googling things and trying to navigate like the census website and all of that. We also do custom projects and for different organizations, whether that's helping with strategic planning or building some navigation tools or for advocates or whatnot. You can see some of those listed here. And then we also do data fluency work where we do presentations and trainings. So through the pandemic especially, we really reworked our entire website, how we talk about data. The World Health Organization has declared an infodemic. So outside of our pandemic and our economic crisis and our kind of willingness to talk about racial inequities now, we also have this infodemic. And I would argue that we've been in an infodemic for like at least a decade, right? With social media, we know that news, whether it's true or false, spreads faster than disease. And so, right now it's really, we have actual health risks with what information we use and decisions we make with data. And so we rebuilt our website and reframed a lot of it and kind of helped reorganized it to try to make this stuff a little bit more easier, more accessible to find. And so this is just a screenshot of our homepage. But within our website, you can find tools. So this is kind of our bread and butter, is this creating maps of we have data across the whole state, but you can make maps of Atlanta neighborhoods and NPUs of all the census tracts or zip codes across the state, cities, counties, different jurisdictions. And you can pull, we have about 2,500 indicators, and that's kind of an overwhelming number, but most of what you're looking for, you can find all here in one place. And like the nice thing about it is that it's just free all the time, right? This is just really is a community resource. And I know a lot of people want the most kind of recent data, what's the day-to-day data during this pandemic, but what we're really seeing and what seems to be most true is that all of these disparities and crises already existed. They're just amplified by the pandemic and economic crisis. And so we can actually understand a lot of what's going to happen based on the community data from 2018 and kind of these historic trends leading up to that. And so even looking at the latest census data can tell us a lot about who's most vulnerable right now, which is, so I'm saying this tool is still very important, even if we're looking for like this week-to-week or real-time information. We built a COVID, I was gonna say a dashboard, but it's really just a landing page for several dashboards that we built. Back in March, one of the first things, just responding to data requests was to help identify, where do people need food? Where are older people that are isolated, right? These are all answers that are questions that we can answer with community data. And so we built a whole series of tools, and there's about 15 or so on this page at neighborhoodnexus.org/COVID-19. And so I just want to make sure everyone knows about that. The Atlanta Regional Commission is kind of also redirecting a lot of, they built some of the tools on this page. We kind of consolidated our tools into one spot. We recently added our eviction tracking tool for the 5-county core region, which I'll show in just a second. Another tool that we have available, and this is, again, I'm just walking through things that I want to make sure that people know about, because you don't have to start from scratch when you're trying to make decisions. Our blog does a lot of deep dives. I think a blog underrates sort of the effort that goes into writing these pieces. And you can see almost everything we're doing now is very relevant to addressing the economic recovery and the public health crisis. We do have one up right now about a map of fall foliage. So that's, sometimes we take a break from the hard questions, but and then weekly, you can see here, the COVID-19 weekly report. This is the one from today. I haven't posted it yet, but you know, we're doing weekly trends at just a high level, right? So including some health outcomes, economic outcomes. We track social mobility when we can. I think that data has become, that's big data based on cell phone tracking, and a lot of the companies that made that available didn't realize that the pandemic would be this long, and it's not always available now. They were making it free. But we're tracking all of these high level trends to kind of just give folks a weekly update, a weekly digest of what's going on and how things are improving. One other thing that's coming very soon, we just got all of the data returned from Metro Atlanta Speaks. Metro Atlanta Speaks is an annual survey that the Atlanta Regional Commission does. It asks actual Metro Atlanta residents, you know, for sort of sentiment and priorities around different issue areas. We just did one partnering with Kennesaw State, and called literally, you know, we got 4,000 or 5,000 responses. So it is extremely significant, statistically significant, for county level responses to what are you seeing right now, what are you feeling? And we asked a lot of questions around COVID-19 and a few around other issues like police interactions and other relevant kind of issues. So that will be coming out soon, and that will give us a lot of local insight into what households are in the area are thinking. And we can break that down by race and ethnicity, age, and counties. I'm going to do an overview, like a general, like a high level hit on some of the key topics that I've been hearing about. If you do want a deeper dive into the sort of economic situation and what we think we know, this Mike and Mike show, this is Mike Alexander and Mike Carnathan from the Atlanta Regional Commission. I would recommend watching this. It's about an hour and a half, and they answer a couple questions at the end. This is just from last week, so this is the latest thinking from the Atlanta Regional Commission on where we're at economically. And I think this is the last tool from our website. But you know, as I mentioned, what's giving us some of the best insights is not necessarily the historic trends that have led us here, but what are different sector leaders seeing right now? And so earlier this week, I built this page, and I'm emailing lots of folks to say, what are you seeing in food? What are you seeing in housing and evictions? What are you seeing in you know, mental health? Whatever issue that you're focusing on, because right now we're getting some of the best insights from our local leaders that are dealing with those issues and dealing with the clients directly. And so we don't always have a bunch of, you know, quantifiable data, but we can get these sort of qualitative insights from our local leaders. And so I've been soliciting that. If you have something that you would love to contribute, shoot me an email and I will happily put that on here. So if it's a report, if it's just a couple bullets, you know, as I hear things from different presentations, I'm pulling them in here. And this is only like 3 days old. So we have a lot of ideas for growing this, but we think that this is a way to kind of collect what different groups are seeing, and then to like spread that back out across sectors, right? So we don't want to keep what housing folks are seeing just in the housing subsector. How do we communicate that out to different groups? And so this is one of those, this isn't one effort to alleviate that and to get more and better information out. Okay, so I'm going to talk about some of the trends we're seeing, and this is one of those slides I deleted, 3 times and put it back 4 times, and so it's here now. It's sort of an executive summary because rather than just walking straight into a bunch of data, I wanted to kind of give an overview of what I'm thinking about. It's also kind of a convoluted slide, which is, so I don't know, we'll see if it works. So when we're talking about emerging issues, or we've been talking about emerging issues, a lot of these issues have emerged, they're here, and we're trying to address them. Those look a lot like workforce, housing, mental health, education, food, and childcare. These are kind of the biggest topics we've been seeing, at least in sort of the nonprofit sector. There's also things like small businesses, like this is, so what I've listed is an oversimplification. Thinking about the populations that are most affected or most in need of services related to some of these, we've got low income families, especially Black and Hispanic households, renters, people without social security numbers and mixed status households, people with limited English proficiency, recently unemployed, and childcare providers. That's different than people who need childcare. And then we have a list of solutions, right? So, you know, do we get cash in pockets? How do we provide internet and devices, workforce development in resilient industries, student engagement, and inverting the burden, especially for families who have never interacted with the nonprofit ecosystem before. You know, where do we even go? We actually just did I was looking at Google Trends, and you can search, you can look at what people were searching for. And if you look at food pantry or food bank near me, it's an incredible spike. I should have included that in one of these, but here's the convoluted part though, because we can attach like a solution to a population to address a particular issue. And so this is again, super oversimplified, and it's always harder to do than just talk about, but trying to map out how we might, you know, provide certain interventions to different populations to resolve, you know, some of the key issues right now. So for instance, you know, internet devices, getting them to low-income families will actually help people look for jobs, train for new jobs, and do on-the-job training. It'll also help people access telehealth and mental health services these days. And it's also how kids are learning, right? And we know that a lot of households, I'll talk about this a little more in depth, but we know that people who have a computer, you're still trying to split that computer between work and education, and it gets difficult. Workforce development in resilient industries for low income and recently unemployed is going to obviously be a workforce solution. Student engagement and kind of like the individualized attention is going to help, especially people with limited English or with IEPs, to have better education outcomes. Inverting the burden is going to help people get food, but in the long run, it's like going to help interact with and navigate any social sector. And then cash in pockets, right? Right now, childcare providers need cash. They need money to stay afloat, and that will help families be able to access childcare. So these are just examples. But this is how I'm thinking about it when I'm just sharing like lots of data. I'm trying to pull threads through to understand how does it actually inform the decisions we make or the actions we take to alleviate these economic and health crises. Okay, so the best place to start for me is where we are, right? Public health is obviously the crisis that caused all of this. So understanding where we're at health-wise, you know, cases seem to be headed in the right direction. We had I was worried about Labor Day, and we had a little bump, but it looks like things are still trending down. Deaths are also trending down with a little bit of lag, which makes sense. You get infected first. We also know that our testing is way down, right? So we haven't been testing as much. And so we're not testing as much as the World Health Organization says we should. I'm not an epidemiologist, so I won't go too much into it, but things are trending in the right direction. Interesting facts about kind of group exposure. About 7% of Georgia's cases are coming from these group settings like colleges, universities, nursing homes, and prisons. This is as of yesterday. And currently, hotspots are largely outside of Atlanta, Metro Atlanta. And there are a lot fewer hotspots than there were even just a couple weeks ago. An important part of spreading disease is moving around and interacting with other people. I know this chart is a little crazy, and it actually gets really crazy towards the end because we had less and less sample data to work with. But you can see that so what this is showing is people leaving their homes or people staying at home. And so you can see that the distance that people traveled on a daily basis, and this is tracking cell phones. Sometimes tracking cell phones is for good reasons, right? So we saw that people minimized their travel for the first couple of months and then really started to come back out. And this only goes through August 5th because this particular data source kind of cut off the data at that point. But you can see that in July, people, when we had the real peak, the second one, that's when people started to stay back home, and people have been generally staying home more and more, which seems to have been effective. One analysis that we're doing, and I think we're doing a blog post next week, and so there'll be more information, but you can look at that staying home trend that I just showed you is also this red line here. And you can put that up against what the disease outcomes are and see that as people started to come back, or people started to stay home more around March 1st, the green line is county policies and state policies. So that's your stay-at-home mandate that happened, where you see that green line go up. That's when the governor shut down everything. So that was the stay-at-home order. You can see that when that came out, people stayed home more. So the red line follows the green line. And then when the green line went away, people seemed to come back out more. But also disease was maybe going down a little bit, right? There were new cases were going down a little bit. And then when the disease really spiked, that second spike that was really just the real one, in early July, you can see that people were staying home more and very slowly starting to come back out, whereas the policies didn't actually change that much. There's a lot of kind of things you can take from this, but I think that you can see that people were being pretty reasonable and following kind of the disease outcomes at the beginning, and then maybe not so much later. So I don't know, there's different correlations. We'll post more analysis later. We also know that there's huge disparities in how the disease has impacted different communities. This is from the New York Times, looking at which ethnic and racial groups are affected most by county. I think an important thing about this analysis is that the New York Times had to sue the CDC to even get this data, which is an interesting policy point. But you can see that, especially in central Georgia, our Black households are most affected. And even in some of the suburbs where it looks, where white families or white individuals are most affected, the disproportionate effect isn't necessarily represented here. And so what we see, and this second one's from the CDC, is that cases are 2.5 times higher for Black individuals, 2.8 times higher for Hispanic individuals, and you can see the same trend for hospitals and deaths. And this is relative to white individuals. So all of that led to this economic crisis that is different than what we've seen before. So this is a map of, or a chart that shows the recovery based on employment of our, you see post-World War II recessions, right? So this is starting at the week that the recession began and what that recovery looks like over time. Ours looks significantly different in that it was extremely fast. And there's a lot of talk about what's the shape of the recovery, right? So this is from 538. They polled a bunch of economists to say, is it a V curve? It is a U shape, a W. We've also seen talks about like an L, which would be it dropped down, but then it kind of keeps, it like tapers out, and it looks like a typical economy, except for it's a lot lower than it started. So there's a lot of different, and maybe that's that swoosh shape there, but there's a lot of different letters we've talked about. The one that I think is most important, whether this is like a real economic term or not, is this K-shaped recovery. So a K-shape means that we've actually got two lines, right? We're not just looking at one shape. We know that people who are able to work from home, people who have higher paying jobs, those jobs are generally more resilient, and they're going to keep investing money, and they're going to keep making money and accruing wealth, while people on the front lines and our essential workers and people in the food and service industry, they already had less resiliency, or less of a sort of safety net. They're already prone to like anything like this, and they're going to keep trending down a little longer. That would be a slower recovery. And so that's where we see like these two directions tapering off. I actually really love this illustration from the Wall Street Journal. And this is, sort of actual data. This is from one of our blog posts, but it's from the Furman Center in New York, looking at low-income families were most likely to have a vulnerable, like a job in a vulnerable industry. So were renters, and so were people of color. So when I say that the people that, like, looking at historic trends where there were already crises and where there were already disparities, it's generally the same households are at risk. Here it's just exacerbated. This is looking at low-wage workers. You can see that this is really looking at high-wage, middle-wage, and low-wage workers, but you can see the blue line, low-wage workers have had kind of the worst immediate impact and the slowest recovery as far as making the same wages that they were. And this is for the state of Georgia. When we look at job loss across different industries, this chart is for the national is a national view. But what we're looking at are from left to right. The further right it is, the less likely you are to be able to work from home. Right? It's hard to be a server at a restaurant from your home. And then the lower it is on the chart is the more jobs that were lost. So if you're on the bottom right, that means you're more likely to have lost your job and less likely to be able to do that job from home. When we look in the Metro Atlanta area, the ones that are circled are the ones that have the most employees, right? So in Metro Atlanta, these are our biggest sectors. You can see that a majority of these cannot be done from home, and most of them, all of the ones on the right, actually all of them have lost employees. And so education and accommodation and food services lost the most. We also know there was a Metro Atlanta CEO article the other day showing that 9.7% of our workforce relies on tourism, which falls into the accommodation and food services. So that's almost 10% of our workforce are directly impacted, immediately, but also are in an industry that's going to be a slower recovery. I was talking to some folks in Brunswick, and down in the lower coast of Georgia, tourism is what drives the economy, being on the coast. This is not great news. This is circling, and you'll see a lot of overlap again, but these are the industries where more than 50% are people of color. So again, accommodation and food services. Educational services is actually not highlighted, but it's like 47%. So we're actually, a lot of our most at-risk industries are employing people of color. And you can see we have a deeper dive on a blog post linked at the bottom. So what this means is, when we focus on economic recovery and resiliency, what industries are we really need to focus on? And John Helton said a couple of weeks ago that we're not going to train our ways out of this. We also have to be creative in the workspaces that we have and the in-person training that we have. But I think it's important to think about, do we need to pivot, right? So do some technical colleges near the coast need to pivot away from, hospitality and tourism industries if we're not necessarily seeing a recovery until 2024 or 2025? Which, this is probably a little pessimistic. I also don't know. And so this is between a virus contained scenario. So assuming we have a vaccine is this white dot, and assuming that we don't, or it takes a little longer than the black dot is maybe like worst case scenario. And so what we can look at is, what are these middle skill jobs that we can train for relatively quickly? And then which of these industries are also expecting a quicker recovery? And we can sort of triangulate to what, say, where we think that we might want to train or think about workforce. Continuing the sort of workforce and economic, and you can look at small businesses and see that 41% of Black businesses were closed by April, 32% of Latinx, 36% immigrant-owned businesses were closed. We also know the Atlanta Wealth Building Initiative mentioned that 62% of businesses, Black-owned businesses, were not prepared to last more than 3 to 4 weeks without revenue. And also that 96% of Black-owned businesses are sole proprietorship. So their only staff, other than themselves, might be a 1099 contractor. A lot of that means that you're not going to get those sort of federal grants or loans. You're not going to qualify for as much support to keep your business open. And we also know that owning a business is a way to generate wealth for your family. And so if you're losing that, then you also don't have income or wealth, and you're just your prospects are diminished. And so how can we support small businesses with either loans and grants or capacity building? We can look at what the grants and loans look like by looking at PPP loans, and you can see, and this is going a little too fast, so it's a little chaotic looking, but more PPP loans were given to South Atlanta and South DeKalb, which is per business, right? Which is good. That's where it's needed most. But the bigger loans were actually going to North Atlanta, north of I-20, which is matches somewhat with the size of companies. But then again, we're really, we're just shining a light on these disparities that have existed for a long time, that companies and businesses that exist in the southern half of Metro Atlanta are less resilient and have less resources and are smaller because of our historic inequities, not necessarily because of the pandemic. And so they're already prone to this risk. So no income, right? We're talking about workers and businesses. No income is going to create no stability at home. So here's a quick overview of how we're thinking about the eviction tsunami. And almost everything we're thinking about housing these days is around the eviction, the looming tsunami. So the early benefits, like $600 a week, the logistics of courts closing, the initial moratorium, all of that kept money in people's pockets and kept evictions from happening through July and part of August. We started to see an uptick of eviction filings in August in the 5-county core region, and for a lot of families that was not in time for the September 1st announcement of the national moratorium. I think that took place September 4th. That does not include mechanisms for dealing with the accumulating debt. And so what we're really doing is buying time that we as the social sector can think about how do we plan for this, but we're also just kind of delaying an inevitable tsunami to hit in probably January, February. We recently built an eviction tracker, so it scrapes data from 5 counties' court websites. These are public records, they're just not very consumable, and so we had to kind of scrape them from the websites. This is a chart from that, and this is for 5 counties, Cobb, Clayton, DeKalb, Fulton, and Gwinnett. And you can see that, in August 9th, that week, you started to see the first kind of uptick in August 16th. And so like almost a month there of upticks before the moratorium went into place. And these are families that are getting these are not evictions, these are eviction filings, but I can imagine that did not go well for a lot of families because they got stuck in between moratoriums and between cash benefits and everything to keep them in their homes. Initially, we thought that the $600 a week would keep people, they would be able to pay rent. And when that ended in July, we thought people would still be able to pay August rent. So we'd see more filings in September, and then we'd see evictions start in October. I think this whole thing has kind of pushed that back a little bit. When you think about who is most affected, like which groups of renters are most at risk of being evicted or missing a payment, this is from the census. They did 12 weeks of household survey. This is from the last week of that survey, and it's a breakdown of who is able to or who is not able to make their rent payments. And it's, again, Black households, Hispanic households, and 2 or more races. Also, families or individuals with less than a bachelor's degree, and pretty much most anyone making less than $75,000 as a household. Again, these are the disparities that we have known about for a long time. The Urban Institute built a really interesting prioritization index, which tells us where those families most at risk might be. We built something similar, it looks a lot like this. And it points to, you see Marietta and then the whole, the I-85, 316 corridor where a lot of Hispanic families live, and then South Fulton, South Atlanta, Clayton, and South DeKalb, where a lot of Black households are. This actually matches what we saw eviction filings. Again, this is from our eviction tracker. So this is real data from actual filings in Metro Atlanta. This map looks pretty similar. And then the next one's blurry and neon colors, but we took the index that Urban Institute made and then layered in all the individual eviction filings on top of it, those black dots. And you can see that actually it was predictive, that model was predictive of what we'd see. And so we know that we can kind of use that profile to build out really not just rental assistance and eviction where we think that will happen, because the same disparities are happening across, access to healthcare and access to mental health and education outcomes. These patterns, it only takes a couple maps of Metro Atlanta to really, pick up on the disparities here. So switching over to health for a few minutes, we know from the Census Household Pulse surveys that they've been doing, and I think they're starting a second wave of those surveys now, that about 40 to 45% of the population in Atlanta, Georgia, and the US it's pretty consistent, have been delaying medical care. And whether that's because you have an emergency and can't afford it, or because you just don't want to take a risk in going to a doctor's office, that's a pretty significant number, and it's been really consistent. And when you compare that to who doesn't have health insurance, you know, again, we're talking about Black and Hispanic families most significantly, and families making less than $75,000 a year. When you look at no health insurance on this map on the left, that highlights where Hispanic families are more prevalent. Public health insurance highlights where Black families are more prevalent. And then private insurance really highlights, not necessarily racially, but where higher income jobs are, right? So people getting health coverage through their employer. And it looks like the exurbs mostly. Similarly, the Household Pulse survey looked at mental health and asked about symptoms of depressive and anxiety orders. And this is a composite of those, but people feeling mental health kind of issues is on the rise. It went from 35 to over 40% in a 12-week period. When you break that down by age groups, it actually shows that young adults, and this only surveyed adults, right, 18 and older, it looks like young adults are have been the most affected by COVID. I think that something interesting to note is that older adults are the lowest here, but they also start from a worse starting point, I guess, as far as mental health goes. We know that aging has its own mental health issues that can be exacerbated by isolation and whatnot. So maybe they just were less affected by the disease because they already had issues, right? Then we would do a breakdown by race. We see that 2 or more races has the most significant mental health issues currently through the pandemic. Hispanic and Black families are kind of close after, but all of these are on the rise. Even when Gears did a survey of their parents working around early education, mental health was the top issue. 62% either agreed or strongly agreed that the caregiving or childcare provision was affecting their own mental health as a parent. And 54% agreed that this was affecting their child's development. And kind of going deeper into childcare, where about half of families had their child in a formal childcare program before March 13th. We're currently looking at 2/3 are taking care of their kids at home with a parent or guardian. And these are families that are also trying to work at the same time. And we know that the greatest need for childcare, again, just like the other maps, is sort of that Marietta area from Chamblee out through Norcross and headed towards Duluth, and then in Southwest Atlanta, South DeKalb, and Clayton County. Childcare facilities, similar to Black businesses, 40% are likely going to have to close permanently. We're actually seeing similar numbers to what quality rated centers are open at the moment. Moving into K through 12, a study that was commissioned by Learn for Life and Redefine Ed showed that we're expecting to lose about 1.5 years of education gains, and that's looking at 3rd grade reading and 8th grade math. We also know that about 12% of our Metro Atlanta students have IEPs, and this must be a difficult time to get any sort of individualized care. You know, it's probably going to, again, you know, if you can afford to have someone come to your house to do tutoring or whatnot, we're going to see disparities in who's able to even do that, let alone have the computers to access learning opportunities to begin with. And we know that students with low English proficiency fare worse from 3rd grade reading, 8th grade math, high school graduation. Related, thinking about the digital divide, I mentioned this, but you know, having a device that's internet enabled and even having the internet allows you to do virtual learning, but it also allows you to look for jobs. I was talking to a group in Macon back in April, and my understanding is that Macon Bib ended their school year a little bit early, but when students gave back their computers that they got from the school foundations, it turned out parents had been using those computers to look for work. And so, there's all of these ways that, having these tools available are really enabling a lot of things, whether that's additional training so you can do more than just your job, or if you're trying to switch industries or whatever it is. And it's also how we can access telehealth and mental health services online. So where are computers available or not? We know that, and this is available for education specifically, again, based on the household survey from the census.
Observation here. If the president didn't know who Proud Boys were, and Joe Biden just threw out the name,
We're getting some
who they
debate
were,
analysis.
If you are not muted, please mute yourself because we're getting somebody's background noise.
So this all remains very puzzling.
Hey, Carol, I think we're hearing something from your computer. Thank you. All right, go ahead.
So this is looking at disparities by race and ethnicity based on who has computers. 2 or more races that are not Hispanic has the least amount of computers available for education. And you can imagine if you have one family computer and you have multiple kids or something like that, how do you manage that? And if you look at it by income, you can see there's an interesting gap for this 35 to 50,000 income range. And I don't know if that's because there's some policy or program that creates a loophole here, but most families making more than $50,000 have a device that is usually or always available for education. We start to see disparities below that. And we can even map this because this is a census question, right? Or an American Community Survey question. And so we can see that where computers exist the least are in Chamblee, Marietta, and Southwest Atlanta. So if we're someone that's interested in giving out computers, I might focus here. And then looking at internet, you can see that the largest disparity here is for Hispanic and Latino families. And the map shows essentially the same thing that all of the other maps show. When we're interested in limited English speakers and accessing services, or even just marketing services in other languages, this is where you would want to target and focus those efforts. And this is looking at through the west side of Gwinnett and up into Hall County. And something I want to hit on, and I literally screenshotted this while Catherine Lawler was giving a presentation from Archie. And when we think about services, we should always think about inverting the burden, right? So how do we change our systems or adapt our systems to make this easier for individuals and families to navigate, and us as parts of those systems to take on the burden to just meet people where they're at. How do we do warmer handoffs, identify things earlier, and target our services? And there's a lot of ways to do this. It takes a lot of coordination. But I think especially as we have just thousands of households who have never needed these things before and have no idea how to interact with our system. And then knowing that historically our systems are not easy to interact with anyways, even if you are using these services typically. So I just want to make sure that this point is made, and is like, we're thinking about this a lot and how to help support organizations do this. And then lastly, these are the things that we have to continue to communicate, and these are basic things, right? So like wear masks, wash your hands, clean things, and social distance. So just to reiterate, these are the basic things that we can all do. I think that's it. So, I feel like that was a lot. It was like high level, but there's just so many things to talk about. It was just like, it's a lot. So, but if there's any questions, and I'm going to try to.
Well, thank you, Tommy. I'll let let's stand this for a minute so I can see some of it. But I mean, we didn't have a lot of questions come through the chat, but I do have a few questions that popped up in my mind. I mean, I think this is telling us what we already intuitively know, right? That COVID is both a health and an economic crisis, and also a mental health crisis and an education crisis. I mean, the crises are piling upon one another, and we, for the most part, the group that joins in these calls are part of that system that you're talking about. Kind of how do we be part of that inversion to take the burden away from the individuals who need to interact But my question pertains to something job related, because that's what First Step does. You know, before COVID, we had been having a lot of conversations around skills gaps being a reason we couldn't get certain populations into jobs, and automation coming along and what that was going to do to the entry-level jobs. And a lot of the data you showed today showed how disproportionately folks in those lower wage jobs have been affected during this time. I would say from our perspective, First Step is actively trying to get people into what tends to be an entry-level job. It's usually kind of their first step back into the workforce after a period of time of incarceration or chronic homelessness. But what we're seeing is wages increase. I would say 70% of our jobs have seen a wage increase over the last few weeks, because we're having difficulty finding people who are available or willing to go to work. I don't know if it's sustainable. It's definitely not high as it should be, but we are seeing a trend, at least in our little, bubble, those wages going up. Are you getting any kind of reports like that from other places? Like, are we starting to see a wage increase for those frontline workers because of COVID, or is it staying pretty stagnant?
Yeah, I think there's been a lot of, I don't have hard data around this, but I've heard a lot of, people making accommodations that they wouldn't have previously made, and then realizing that those accommodations or, whatever it is, changing their policies have actually stuck around because they're having a good impact. I imagine that, paying more might be one of those things, right? They might find that there's better retention or easier to recruit, especially when people, don't want to be a frontline worker. It's not something that people are, necessarily wanting to do. I don't know. I know that we've seen a trend over time, over the last few years, with our Metro Atlanta Speak survey, that people are less and less threatened by automation, because we've been talking about it for so long, that you haven't seen your job go away, that you start to kind of forget about it. I think we're really seeing that happen very quickly, where a lot of jobs are being automated or combined with other jobs or just eliminated altogether. And so I imagine, I'm not sure we asked the automation question this year, but I think that'll be interesting to see if people start to see a spike in like seeing that as a risk to their own job now. But yeah, I don't know. I'll check that out more. Like I mentioned earlier, like we hear things from local leaders in the industry. So I'm hearing that from you, and I'll check it out. Yeah.
We do have a question from the group. So Chuck Barlow asked, how can we connect more opportunity youth and residents to the WIOA opportunities by removing all the barriers that have continued to exist? So anybody who's had to interact with that system or apply for a voucher for someone or help somebody through that, or even as an employer or a training provider trying to get through it, it's burdensome. We know it is. So are there things that we could start to request now from a policy standpoint to remove some of those barriers?
I'm not the person to answer that question, so I won't try. but yeah, that's, if there's anyone on this call, since this is a workforce group, that can answer that or give insights, I'd love to hear it.
Yeah, I know, John, you're John Helton. I don't know if you're still on and listening, but are you seeing any efforts by our workforce board as we're realigning kind of our application process and systems that would start to remove those barriers?
So thank you, Amelia. I'm sorry, I'm not going to be on video because I'm actually on the move. So I'm on my iPhone this morning. So no video, but yes. And I don't know that any of my other WIOA colleagues are on the line. But so yes, a couple of things to speak to that. And yes, WIOA is a bear on the best day, right? In terms of eligibility and the requirements, because it's a federal program. We have made some great strides. So I can tell you that in the past year. And it's really platformed off some initial work that was begun by the Atlanta Regional Commission and WorkSource Atlanta Regional and Rob LeBeau with atlworks.org. So if you haven't visited atlworks.org, I really encourage you to do that. And if Joy, if you want to put that in the chat box, I know I've been on that soapbox for a few months now, atlworks.org. But it's a centralized intake and intake platform for anyone who's interested in WIOA funded training as an adult or dislocated worker, right? So if you had asked me if we'd ever be at this point a year ago, I would have said, no way. But in some ways, the pandemic has accelerated our work on trying to standardize those processes and policies and procedures for how one accesses WIOA funded services. We're not quite there with the youth program yet, to Chuck specifically for your question about opportunity youth, because that money is handled a little bit differently in the way the services are delivered in the WIOA system. But we are looking forward to the future of how atoworks.org could also serve as a similar tool to help standardize processes and just make it easier. I mean, just the fact that all 5 workforce areas across the metro region now have agreed that this is going to be the central point of intake and that we're all saying the same thing is a huge milestone, right? And so we can continue with that. But I do want to tell you, WIOA funding, right now ARC is on hold. They don't have money to support training for any additional intakes right now for either dislocated workers or adults. And DeKalb is in the same situation. Cobb's in good shape right now in terms of funding. But WIOA allocations are based on historical data for unemployment rates and other allocation factors. So, we were doing really well the past couple of 3 years prior to all this hitting. So we're finding ourselves now in situations where there's not an available funding source to support the magnitude of what the need is at this point. That's a short answer. Thanks.
Okay. Thank you, John. We do have a question from Paul Workman. He says, have you been able to review any data based on persons with disabilities?
Not anything more in depth than looking around education. We were interested to see how many students with disabilities there are in the metro region, to see if they're going to be able to get individualized sort of attention from either their own teacher or elsewhere. But no, I don't think we have. And I was just scrolling through who's on the call. I saw Jim is on there. I don't know if Jim works at the ARC research group and it's kind of economics guy. I don't know if you're.
Yeah, there's going to be a good deal of cross-tabulation from the Metro Atlanta Speaks questions by disabilities. So we'll be able to bring that into play. And there's some limited cross-tab available in one of the smaller area products from the American Community Survey. So we can look, more in depth at disability through that context as well. But it's very limited, sadly, compared to some other more broad crosstabs like race and income in terms of looking at the data that way. But it's a great need, obviously. We'll continue to try to do that.
Thanks. Kind of similar question from the group. Has any work or research been done specifically on the homeless community in Metro Atlanta?
Right now there's the Healthy Hotel, which I don't have as much information as I should have, but I think Mercy Care was leading that effort. I know Archie is involved with it. And that was taking in 200 street homeless individuals and providing wraparound services and making sure that, one, that they're being taken care of because they already had a lot of needs being in a housing crisis of their own, but then making sure that they are able to protect themselves from the pandemic. And I heard yesterday there's been 0 cases, and so they're actually must be effective. And I think Archie is doing some evaluation on how we offer those services as a way to think about inverting the burden, right? We're providing lots of services to people in one location. And so, maybe this is providing, I think, like John mentioned, this is sort of a terrible time, but it's also an interesting time to test out policies and programs that may have that we can take on beyond this and learn a lot from it. So I think we're trying to make the best of what we can.
Yeah. Well, I've actually been to talk to the caseworkers at the Healthy Hotels as we're trying to get those folks connected with jobs before that housing opportunity runs out. And I think they've done a great job with it. We're running close on time. We do have one more question from Chuck, but I think this is a larger question for contemplation for everybody on the call. What roles do community organizations play in this conversation, and can this data be used to empower residents? Since many on this call are part of community organizations, are the front line talking to the people most affected by all of these issues. I think that's a question for this group. And I do think, personally for me, the opportunity to gather with groups like Max and others that have come together specifically to be able to do these warm to hot handoffs amongst ourselves, so we understand who the other providers are in our ecosystem, does absolutely bring a higher level of impact and outcomes. So the more we can continue to do that and kind of remove the silos that might exist, I think we're going to be in much better shape for our communities. But I think we got 1 more minute, so I'm going to steal the screen back from you, Tommy. is going again. Zoom slideshow, okay. So just quickly, we do have another Max Minutes coming up on October 16th. That one will be focused on education from Dr. Barbara Wall with Georgia Department of Education and with Ken Zeff, who is the head for Learn for Life. This presentation that Tommy gave, Joy will send out per her usual, so you'll have that in your inbox with all the great data and graphs, and we'll have the information on where to go to get that from Neighborhood Nexus on a regular and live basis as they update it. Again, thank you to our anchors for helping make this happen, and we hope you all have a very good weekend. Thanks for tuning in.